Imagine living with pain so constant, it quietly shapes your days. A dull ache during meetings, sharp cramps at night, and questions you can't quite answer. For millions of women, this isn't just bad period pain, it's endometriosis, a disease often hidden, often misunderstood, but deeply real. Endometriosis affects 1 in 10 women of reproductive age worldwide, yet many wait years, even decades, for a diagnosis. Some are told it's normal, others are told it's all in their heads. But the truth is, it's a medical condition that deserves understanding, compassion, and care. In this video, we'll uncover what endometriosis really is, why it's so complex, and how women can find hope and healing along the way. And throughout it all, remember this: you are not alone. There's love, there's community, and there's power in your story. What is endometriosis? Endometriosis is a condition where tissue similar to the lining of the uterus, not identical, but very close, starts growing outside the uterus. Imagine this tissue acting like it's still inside. It thickens, breaks down, and bleeds with every menstrual cycle. But outside the uterus, there's nowhere for that blood to go. This trapped tissue can cause inflammation, swelling, and the formation of scar tissue called adhesions. These adhesions can make organs stick together, the ovaries to the fallopian tubes, or the uterus to the bladder, leading to pain that's often chronic and unpredictable. Endometriosis can be found in many places: on the ovaries, the fallopian tubes, the outer surface of the uterus, and sometimes even the intestines or diaphragm. And while this may sound purely physical, it's not. It's emotional too. Many women describe feeling betrayed by their own bodies, but you are not broken. Your body is asking for care, and it deserves love, understanding, and proper medical attention. How common is it? Endometriosis affects an estimated 176 million women and girls worldwide. That's roughly 1 in 10 of those in their reproductive years. Yet despite being so common, it often hides in plain sight. Many women spend years seeking answers, visiting doctor after doctor, only to be told their pain is normal. For others, the symptoms are misdiagnosed as digestive issues, stress, or even anxiety. That long road to recognition can feel isolating, but it's important to know you are far from alone. Endometriosis doesn't discriminate. It affects women of all backgrounds, lifestyles, and ages. It's a silent epidemic that shapes work, relationships, and dreams. But slowly, voices are rising, communities are forming, stories are being shared, and love is replacing shame. Each voice makes it easier for another woman to be heard. Symptoms and impacts. For many women, the first sign of endometriosis begins quietly, with painful periods that seem worse than normal. At first, you might brush it off. A hot water bottle, some painkillers, maybe just another tough month. But as time goes on, the pain doesn't fade. It grows sharper, spreading through the pelvis, the lower back, even the legs. Endometriosis pain isn't just during menstruation. It can appear before your period, during ovulation, or during sex. Some women feel pain when going to the bathroom, or experience bloating so severe they call it an endobelly. Fatigue sets in too. The body constantly fighting inflammation takes a toll, leaving you drained and exhausted. Periods may become heavy or unpredictable, and for some, fertility becomes a struggle as scar tissue affects the ovaries or fallopian tubes. What makes endometriosis especially confusing is how unpredictable it is. Small lesions can cause severe pain, while large ones may go unnoticed. No two women experience it the same way. This mix of physical pain and daily disruption explains why endometriosis isn't just a bad period. It's a complex medical condition that deserves early recognition, understanding, and real support. Causes and risk factors. Even though endometriosis is one of the most studied gynecological conditions, its exact cause is still not fully understood. Scientists believe it's not just one factor, but a combination of biological, hormonal, and genetic influences. One of the main theories is retrograde menstruation, when menstrual blood flows backward through the fallopian tubes into the pelvis instead of leaving the body. These cells can then attach to nearby organs and continue reacting to monthly hormone changes. But this doesn't explain every case, since many women have retrograde flow without developing endometriosis. Other possible explanations include genetics, it tends to run in families, immune system dysfunction, the body doesn't clear misplaced tissue properly, and cell transformation, where other pelvic cells change into endometrial-like cells. Certain factors may also raise risk, such as starting menstruation early, having shorter cycles, or never giving birth. While causes differ, what's clear is this: endometriosis is a real physical disease, not just in someone's head. Diagnosis, challenges, and methods. Diagnosing endometriosis can be one of the hardest parts of the journey. On average, it takes 7 to 10 years from the first symptoms to a confirmed diagnosis. That long delay often happens because the symptoms, pelvic pain, bloating, fatigue, overlap with other conditions like irritable bowel syndrome or ovarian cysts. Doctors usually begin with a detailed medical history and physical exam, sometimes followed by ultrasound or MRI scans to look for cysts or scar tissue. But even with imaging, smaller lesions can be invisible. The only way to confirm endometriosis with certainty is through a laparoscopy, a minor surgical procedure where a tiny camera is inserted into the abdomen to look directly for endometrial-like tissue. If found, the surgeon can also remove or biopsy it during the same procedure. The process can feel frustratingly slow, but a proper diagnosis is life-changing. It validates the pain, guides treatment, and gives women a clear name for what they've been battling all along. Treatment options and living with endometriosis. There's no single cure for endometriosis yet, but there are many ways to manage it and help women reclaim control over their lives. Treatment depends on the severity of symptoms, age, and whether someone hopes to become pregnant. For pain relief, doctors often start with non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, to ease cramps and inflammation. To slow or stop the growth of endometrial-like tissue, hormonal treatments are commonly used, including birth control pills, hormonal IUDs, or medications that reduce estrogen levels. These don't eliminate endometriosis, but they can make symptoms far more manageable. For women struggling with infertility or severe pain, surgery may be an option. Through laparoscopy, surgeons can remove visible lesions and scar tissue, sometimes restoring fertility and reducing pain for years. But managing endometriosis isn't just about medicine. It's also about daily living, finding balance through rest, nutrition, gentle exercise, and emotional support. Many women discover strength in support groups or therapy, where they can speak openly about what they're going through. Living with endometriosis means learning to listen to your body and care for it with patience and kindness. Healing doesn't always happen overnight, but with the right care and community, life can still be full, vibrant, and deeply loved. Why it matters. The bigger picture. Endometriosis is more than a personal struggle. It's a public health issue. Beyond pain and fatigue, it can affect fertility, making it harder for some women to conceive. For those dreaming of motherhood, that uncertainty can be deeply emotional. But with proper treatment, many women do go on to have healthy pregnancies. Economically, endometriosis carries a huge impact. It leads to missed workdays, medical costs, and sometimes the quiet loss of opportunities. Yet for years, it's been underfunded, underdiagnosed, and underdiscussed. Raising awareness isn't just about sharing stories. It's about changing systems so women are believed sooner, treated faster, and supported more fully. Every conversation, every shared experience helps lift the silence. Because when we talk about endometriosis, we don't just fight a disease, we fight for women's health, equality, and dignity. Looking ahead, research and hope. Science is moving forward, and with it, hope is growing. Researchers are exploring new treatments that target inflammation, nerve growth, and hormone pathways more precisely. Studies on the immune system, genetics, and even the gut microbiome are helping uncover why endometriosis behaves so differently from woman to woman. Awareness campaigns and advocacy groups are pushing for earlier detection and better care, giving women the confidence to speak up about their pain. Most importantly, no one has to face this alone. Community love and knowledge are changing the story every day. Endometriosis is real, complex, and deeply human, but it does not define you. With knowledge, care, and community, women can live fully and beautifully beyond the pain. Thank you so much for watching, and don't forget to subscribe for more stories that matter.